Hi everyone, it's Dr. Steph. I'm here at the Menopause Conference and I wanted to give you a quick little recap of the last 2 days, so here we go. Day one was almost entirely dedicated to perimenopause. The lecturers talked about how important it was to start talking to our patients as early as the age of 35 because we know that a lot of patients will start to experience symptoms in their late 30s, even before their cycles changes. For example, mood, anger, irritability, all those mood changes that start to happen. We also know that perimenopause is a time to really assess your health and that it can be a window into your future, just like pregnancy is. Also, for women that have abnormal uterine bleeding, so important to also work that up. Sleep disturbances were a big theme in this conference so far, and in midlife, we see that there's sleep disturbances in perimenopause and also in postmenopausal women. It's so important to work that up for sleep apnea. Menopausal hormonal therapy may help with some women that have vasomotor symptoms and help with sleep. Women that experience childhood abuse were noted to have more severe vasomotor symptoms, and there was an increased risk of depression in midlife within 2 years of the final menstrual period. Then we get to day two, which is today, and the lecturers started talking about ovaries and how they were the pacemakers for aging in female bodies. Ovarian function was also important at every age, and across female lifespan, it uncovered different health risks. Ovarian function was linked to metabolic and immune function. Then we talked lots about sleep and noted that women with poor sleep quality have greater vascular inflammation despite adequate sleep. And having a stable sleep pattern reduced total fat and subcutaneous fat. Also, being sleep deprived led people to make poor food decisions. And obtaining adequate sleep helped with weight management. So that was super important. Also, adhering to a Mediterranean diet led to better sleep quality, less frequent sleep disturbances. And there was other data that noted that greater intake of fruits, vegetables, and legumes helped also with sleep. Then it was all about bone density and osteoporosis. Then we talked about progesterone, progestins, and the IUD and how important contraception can be during the perimenopause phase and how IUDs are so important for endometrial protection. Last but not least, there were lectures on vulvar health. Now I'm totally looking forward to tomorrow's lectures, and I'll keep you updated. Bye.